Hey guys, I get a lot of questions about BPC and TB500. What are they? How do they work? How do I inject it? Where do I inject it? How much do I inject? What about the frequency? So I'm going to cover those questions for you today. Now we do have these peptides in other forms. We have it in nasal form, we have it in oral form, and we do have the peptides in a topical form. We have them standalone, so BPC-157 independent by itself, and we also have TB500 independent by itself. We also have them as a combination. I'm a firm believer that in my own practice and application with using these two peptides and pairing them together, I've seen significant results as far as improving with health, when it comes to healing, when it comes to inflammation control, pain control. There's tremendous benefits within these two peptides. And again, I want to go over some of the basics on how to do the constituting and things of that nature. So the first thing you're going to do is you're going to need to have some bacteriostatic water or backwater. You can get reconstitution solution. I use backwater. I get this right on explicitsarms.com. From there, we're going to take our fresh vial of the BPC-157 and TB500. Now you'll notice it's a 5 milligram vial. What does that mean? That means it's 5 milligrams of each active ingredient. You can, by all means, have a bottle of BPC-157 and a bottle of TB500 and separately constitute and put them in a single syringe and inject them, or you can just do it in one. We're just doing it in one and makes your life a lot easier. What we're going to do is we're going to pop the top off. Okay, top is off. We're going to have to constitute it and put this bacteriostatic water inside of this vial. So what we're going to do is this. These are always going to be sterile syringes. We're going to pull. You don't have to do this. So what we're going to do is we're going to pull this to 100 units. Now we don't always have to do this, but I like to do this. It just helps me put a little air in this, gets a little more pressure there. When you pull it out, it helps put the liquid in here. So we're going to put it in the middle here. Okay. And push the air in there. Look, without me even pulling, it's pulling it out organically. Okay. I'm going to finish doing the job for it and pull this bad boy out organically. We're going to pull it down to 100 units. Now, when you're getting these syringes, okay, we're at 100 units, you're always going to want to get the 1 milliliter or 100 unit syringe. You can see I went in a little sideways. The needle head is a little crooked. 100 units, these are 1 milliliter or 1 cc syringes. So we're going to put 100 units, aka 100 units or 1 milliliter or 1 cc of water into this. Now, when you see this, you'll see a little valley in the middle. Now, again, these are sterile. We just pop the tops off, so I don't have to use the alcohol swabs to sterilize them because they're already sterile. After I do this, and once I store it, which when you're done doing this, you always want to store it in a refrigerator. Then I will need to swab it again before I pull the compound out with a new needle. Always use a new needle. You're going to lose the sharp of the tip, and you don't want to cross-contaminate any kind of bacteria, because what could happen if there's bacteria dormant on there, you can push that bacteria in here